Hello, this is Dr. Nandini Sasrabuddhe. Welcome back to Healthcare Simplified. This is part 2 of the COVID-19 series. In this part, we will discuss everything that you want to know about COVID-19 immunity and vaccines. I hope you have seen part 1 where we discussed how COVID-19 infection takes place, and if not, do check it out. Please go through the standard disclaimer. None of what we discuss is healthcare advice. Do consult your physician before you make any decision. Let's jump in. Probably you remember this image of COVID-19 virus from part 1 where we discuss the structure of the virus, right? So the genetic material, as you see like a spring here, is packed in an envelope, and there are these bluish spikes on outside, which we discussed a lot about in part 1, which are important for infection. Similarly, they are important for immunity. What happens when our body is exposed to COVID-19 for the first time? In all these other diseases like chickenpox, measles, or flu, either we have had vaccine or we've had a previous episode of that disease. Because of that, our body is aware of that virus, and that's why it has very specific response for that virus. In case of COVID-19, it hasn't seen the virus before, so there is no specific response. However, our body does have a generic response, which is called as innate immunity. In this case, there are certain cells like macrophages which are on constant surveillance, and if they find something odd which is foreign and which could be dangerous, they try to chew it off. They try to chew off the virus and infected cells. Also, there are danger signals that are emitted so that the surrounding cells are alerted that there is something wrong and they should be cautious. This is non-specific, but it's very quick. For bug-specific immune response to develop, it takes some days. It takes about 7 days. There are these cells, B cells, which produce antibodies which are specific for that virus. And then there are these cells called as T cells, which one of their functions is to create this memory of virus so that if there is attack in future, we are able to respond very quickly. But like I said, for the first time, this is slow. And many a times, by the time the specific response develops, which is very, very effective to kill that virus, it is too late. And our body has suffered a lot. And that's why vaccines are really important. Vaccines, they help our body to develop memory without actually being exposed to the virus. Vaccines contain stuff that mimics parts of virus. So this is not a whole virus, but it's a part of virus, which is able to wake up our immune system. These are called as antigens. Antigens are special in terms of their composition and arrangement. Any part of virus or bacteria doesn't necessarily have all those properties that are needed to be a good antigen. That's why, as first step in any vaccine recipe, is to find that best antigen that will leave a long lasting memory of how to attack that bug when we encounter it again. In a vaccine, apart from antigen, there are a lot of things that are mixed up so that it is delivered safely to the site where it should reach, and it shouldn't be chewed up in our body while getting delivered, or it is not destroyed when it is stored and packaged. It has to be active enough when so that it actually is able to do its final job of triggering our immune system to create this new specific antibody. Let's see some examples of different types of vaccines now. Broadly, there are these two important types, one where whole virus is used, and another new one that has come up where genetic material is used. This has been a traditional method where whole microbe is used. In the first example here, we have that actual virus which is inactivated through means of radiation or heat or chemicals. One example of COVID-19 vaccine is Covaxin, which is produced in this way. This is a pretty traditional method of creating vaccine. The second one is live attenuated vaccine, which essentially means that the virus is not really virulent, which means that it's not really going to cause the disease, but it is live and it can trigger the immune system. And this approach does create really strong immune response. And that's why these types of vaccines may not be really suitable for people who have compromised immune system because of specific reasons. The third type is viral vector vaccine, where specific subparts of the virus are produced through something called as a vector, which is packaged inside a safe virus. So this is more like a delivery system, and inside that delivery system, which is virus, you have instructions on how to make that virus specific protein. Example of a COVID-19 vaccine which is produced in this way is Covishield, which is widely used in India. The new type that has emerged because of this COVID-19 pandemic is genetic material based vaccine. Of course, there were a lot of efforts that were made in this direction earlier, but nothing really reached the final approval or emergency approval until COVID-19 pandemic happened. So in this case, what happens is it uses a section of genetic material that provides instructions for specific protein and not the whole virus. So if you remember that spike protein, this RNA which is inside, it is going to provide instructions for producing spike protein against which immunity will be developed. This new way of developing vaccine, like I said, before COVID-19 pandemic, none had been through full approval process in humans. And COVID-19 did really push the whole process. Having discussed different types of COVID-19 vaccines, we should also be aware of side effects of vaccines. Generally, serious side effects are not observed. The common ones are injection site pain, headache, nausea, which will subside in few days, and they don't really cause complications. But in rare circumstances, there are some serious ones, and this is really few in several millions, where there could be serious allergic reactions which could lead to hospitalization. In a vaccine called vaccine from Johnson and Johnson, there have been some rare blood clots that have been reported, and in rare cases there is a syndrome which is triggered called as Guillain-Barre syndrome, which leads to paralysis. So it is important for all of us to monitor how our body reacts after vaccination. If one suffers from any serious medical condition or is on some medication which is suppressing immune system because of transplants or otherwise, one should check with physician and treating whoever is treating you to check if you are eligible to take vaccine and which type is suitable for you. Having discussed the side effects, it still outweighs the benefits outweigh the risks. With Omicron, what became apparent is there is this evolution of different variants, and even the vaccinated people did get Omicron infection, right? So there were these questions raised on if really COVID-19 vaccine is useful. CDC came up with this data, or CDC, this is sourced from CDC, that the unvaccinated population had 5x higher risk of infection compared to adults who were fully vaccinated with a booster. So even if they did contract the disease, the percentage was much higher in people who were not vaccinated. Secondly, the severity of the disease was much lesser. There were less hospitalizations and so on. So this study, which was conducted recently, I think, further fortifies this claim of why vaccines are really important, even though it may not fully protect you from getting infected from a new variant. It will protect you from getting hit badly. Also, something which probably some of you might have heard of, is herd immunity, and vaccination plays really important role in herd immunity. What is herd immunity? It is a situation in which big part of a population is immune to a particular disease due to vaccination or previously suffered illness, and as a result developing antibodies. This indirectly also helps ensure the protection of the remaining population, the ones who are in maroon color and the green color, right? So the green color are the ones that are not vaccinated, and they could be protected because of um, this uh, this phenomenon called herd immunity. So it is at times really not possible to vaccinate entire population, right? There could be different reasons for it. So like we discussed earlier, there could be people with weak immune system. There could be people who are taking specific therapies like chemotherapy, newborns, people who are living with HIV. And yes, of course, as you must have heard a lot on social media, there are people who refuse vaccination. So there will be some percentage of population who is not vaccinated. But if there is an infected person who is surrounded by people who are vaccinated, the transmission really does taper down over time. So in many cases, herd immunity ensures that while not everyone is able to get vaccination or that immunity to the disease, everyone can enjoy protection from it. So it's important to, you know, take our vaccination program to as many as possible. So that really should be, the next step. This is data from yesterday, and India, I think, is on a big drive of vaccination, and I see a lot of people around me who are getting vaccinated, and this will, eventually, hopefully, lead to herd immunity. Also, globally, there is, progress over time that is happening. The next question, of course, everyone has is what about kids? And in recent time, there has been progress on this, right? So in India, Covaxin is approved for kids who are between 12 to 18 years of age. And there are other candidates that are being tested like Covax and Corbevax. In US, Pfizer's um vaccine is approved for kids who are above 5 years of age, and is also being tested for kids below 5. I think they're still testing it, they're not yet submitted to FDA. So there is a lot that is happening in the COVID world still, and the picture is definitely positive. Here, I think that brings us to the end of this video, and I hope you really like this. I hope you hit the like button. That really encourages me to take new topics for discussion. Do leave your comments if you have any feedback. Share it with your friends and family so that they are benefited from what we discuss. And subscribe and press the bell icon so that you get all the notifications. Thank you.